Doctors and nurses are not the only medical professionals who have felt the stress of COVID. Emergency medical technicians, or EMTs, are suffering with it too. Staffing shortages at Ohio's ground and air ambulance companies are causing those who are left to make difficult choices. Statehouse correspondent Jo Ingles talked to a privately run patient transportation service about that.
Like other health professionals, EMTs have been struggling with long hours and an increase in patients to transport because of COVID, and of course, being exposed to the virus from the very beginning. But while hospitals have raised pay to attract and keep staff and have hired expensive traveling medical professionals, private ambulance companies haven't been able to do that because their rates are set by government and private contracts. Ken Truax works at Superior Ambulance, a private company that does patient transport in 5 states, including Ohio.
It's tough. It's tough to deal with. So we do our best to, to thank them and show appreciation, but they're in the building for 20 minutes in the morning and they're not running calls the entire shift because there's not enough people. They're dealing with stressed out nurses and doctors because they're having the same problem. And that's just not easy. That's not something that you want to do day in and day out. So you go to Best Buy and get a job that pays equal. You go to McDonald's, you go to Thornton's. I mean, these are places that are paying equal to or higher than an EMT is making starting out, close to what paramedics are making. And then the hospitals now and doctors' offices are finding new ways to compete with us and saying, oh, we'll hire paramedics and EMTs to do the jobs that nurses and nurse assistants have done. So they go there. They're in a safe office space. They're not worried about the road or cold conditions or the snow, and life is a little smoother for them.
Keeping the system running smoothly is Raymond Jenkins' job, and he says it's hard to do that.
So we've definitely seen an increase in COVID-related patients just because of the isolation precautions that come with it. If they're going home and a family member can't get them, that now falls on our lap. So those runs have gone up. We're also seeing our workload from a traditional sense, the injuries, the infections, the things like that have always been around. So it's just an increase. We're seeing more and more runs every day. The runs are taking longer because there is a decon aspect. And as far as my job goes, that kind of affects my planning, because I kind of plan where the trucks go and when they're going to be there and at what time and priorities. So it's created an increased workload on kind of everybody.
Hospitals and nursing homes are struggling to handle the huge influx of patients. Sometimes hospitals go on what's known as emergency bypass, notifying EMTs that they can't take anymore.
So when we're transporting a patient that's a critical patient to a facility that we expect is only 5 minutes away, 7 minutes away, and they're on bypass, we immediately have to divert, and they won't accept that patient, and we have to go to another hospital system that's farther away possibly. It might not have the needs that actually go to that patient, but we have to get that critical patient to the closest facility. Most ERs can handle just about everything, but then that patient will have to be transferred again to the appropriate neurological care or cardiac care at that point. Wherever in the system that they need to go. And it just delays that patient care and requires another transfer, and it just backlogs everything.
Superior's medical director, Dr. Ryan Kanzler, says it's important to get patients transferred out when they no longer need medical care. But he says that's difficult sometimes.
So the nursing home accepts the patient. You then have to call the ambulance squad to get the patient out of that bed and into the nursing home. If there's a shortage of the private ambulance systems, that patient doesn't move. And if that patient doesn't move from a hospital bed, no one else can take that hospital bed. And every morning there's a wait of patients, whether it's surgical patients that after surgery are going to be admitted for post-surgical care, whether that's new ED patients that are being admitted, or patients being admitted directly from primary care offices that go to hospital beds. All those patients are waiting for that resource, and that resource is a medical bed. And that resource depends on an EMT to get that patient out of that bed to home, a nursing home, or wherever they need to go. So every hour that you lose, you're losing a patient, a chance to move other patients. So it really slows down the whole system.
And throughout the pandemic, the usual calls still come in, such as for heart attacks, car crashes, and drug overdoses. Unlike hospital and public safety forces, private ambulance companies didn't get CARES Act funding, and they did not receive pandemic assistance. The problem is exacerbated because Ohio's Medicaid reimbursement rates are low, in the bottom 15% of the nation's rates. Jo Ingles, Statehouse News Bureau.